DocTalk is brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Hi there, welcome to DocTalk. We're sure glad you joined us today. We're going to have a great show. I'm going to be joined by Dr. Susan Nelson, who's an associate clinical professor here at Kansas State University's Veterinary Health Center. We're going to talk about fleas and ticks in the dog. Thanks for joining us and stay tuned.
We've been using the Multimin on our donor cows, and after we started using it on them, we've seen a definite increase in grade number 1 embryos. I like the results that I get using Multimin with the AI conception rate.
Their minerals not up to snuff, you're gonna have problems, and I definitely think Multimin is good for, general healthiness of the cattle.
We think Multimin more than pays for itself.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. This segment is brought to you by Norbrook Laboratories, manufacturers of Normycin LA, Normectin Plus, 1%, and Poron, the practical choice for your herd. Well, welcome to the show.
Hello, thanks.
Thanks, it's always good to have you here. This is Dr. Susan Nelson. She is an associate clinical professor in the Veterinary Health Center here at Kansas State University, and we're going to talk about fleas and ticks.
Yes, we are.
Today, and dogs, and if we have time, cats.
Mm-hmm.
But, can you just kind of kickstart us on, what are some of the things, what are they, why are they important?
Right, okay, so I think most people know the difference between fleas and ticks. Fleas are the little things, get in your carpet, get on dogs. They can cause a lot of problems. They can spread some diseases, but primarily, if your dog's allergic to them, we get a lot of hair loss. The bites can get secondarily infected. And if the numbers grow enough in your home, they may even affect you or the rest of your family members. Ticks are just gross. I think we all know that. They just give me the heebie-jeebies. But
That's
anyway,
right.
They're a little bit bigger and easier to spot for most people. They transmit in this area. There's several diseases that dogs can get from the ticks, so we need to watch out for those. Some of them can be very serious if they're not treated. And then there again, they can make them uncomfortable. Both of those ingest blood from the pet, from that dog. And so if it's severe enough, if they have enough, they can be anemic from those. And so the list just kind of goes on and on and on. These are bad things to have.
What about times of the year? Are there certain times of the year that this is more of an issue with fleas or ticks?
In this area, we definitely see some seasonal jumps and increases in the numbers. But anymore, the way the climate's, especially the past couple of years, has been pretty warm and mild, I'm a believer of year-round. I see these animals, we see a lot of them come in that have been outdoors, not on flea and tick preventive in the winter, coming in with fleas. I'll say I'll probably see more fleas in the winter, but if it warms up sooner than later, we're going to see ticks earlier like we did last year, and with a mild winter, a large number of ticks in that spring coming in. But I would generally say year-round, with ticks really peaking in the spring, another late bloom in the fall. They'll hang around through the summer. Fleas all through the summer, and then in this area, fall is where they really tend to peak and cause some problems.
Bloom.
Yep.
What about the barn cat? I mean, we talked a little bit about some of the negatives that we can have on dogs, but I assume that we have similar issues.
There are. So with the fleas, there again, flea bite anemias, hair loss, being uncomfortable. It can spread some of the diseases that cats get from biting one cat and going to another. The other thing is we see a couple of diseases with the ticks. One is cytozoonosis. It's a blood parasite that's transmitted in this area. It's about 100% fatal. It's a very, I hate seeing the cats come in with it. They look miserable. They are miserable. It's a pretty rapid death for them. Another one is Tularemia, which primarily they get through eating rabbits, but we also know ticks can transmit it too. And so that's another one that your cat can get. They're getting very sick. If they're not treated with the appropriate antibiotic, it can be life-threatening for them. Plus, they can transmit it to you.
Well, very important situations, and maybe when we come back, we'll discuss a little bit about things to watch for, things, clinical signs, and different things like that.
Sounds good.
It's always great to have you here.
Thanks.
We appreciate you watching DocTalk as well. After the break, more with Dr. Susan Nelson on flea and ticks in dogs and cats. You're watching DocTalk, and we're sure glad you joined us.
This segment was brought to you by Brute Cattle Equipment, makers of the Brute Stealth Hydraulic Chute. If the chute fits, swear by it. Visit our website for more information. Be Beef producers need a practical choice when antibiotic therapy is required. More than ever, they are reaching for non-prescription Noromycin 300 LA from Norbrook, specially formulated to produce sustained antibiotic blood levels up to 4 days in cattle. Noromycin 300 LA delivers economic, broad-spectrum disease management for pneumonia, shipping fever, pink eye, wound infections, and foot rot. See for yourself why Norbrook's Noromycin 300 LA is the practical choice for your herd.
Here in Dallas, we're proud that our vehicles use an advanced biofuel called biodiesel. It's made from renewable resources like soybean oil, canola oil, even recycled cooking oil. This year, biodiesel will displace almost 1 billion gallons of fossil fuel nationwide. Our air is cleaner, our economy is stronger, and America's more energy independent. It's working here, it can work in your community. Biodiesel, America's advanced biofuel.
Dr. Dan here. Whether I'm driving up and down the roads covering the state of Kansas, or I'm getting between Riley and Manhattan for my job, I'm driving a Ford truck. I'd like you to come out and visit my friends here at Dick Edwards Ford. They have a truck that'll suit your needs, whether you're looking for power with a Power Stroke diesel, or if you're looking for fuel efficiency with the new EcoBoost engine, they got a truck that's just right for you. They're located 2 miles east of the Town Center Mall in Manhattan, Kansas, and they'll bend over backwards to help you. And I'll see you down the road.
Got cattle? Rotomix manufactures a complete line of energy-efficient rotary and vertical feed mixers for feedlots, beef production, dairy, and cow-calf operations. Our mixers are available with the patented Generation 2 staggered rotor, the industry standard for feeding wet rations that include wet distiller's grain. Made in the USA, Rotomix mixers are designed for feeding performance that American cattlemen and dairy producers have come to expect. Rotomix, proud to offer a better mix in less time using less fuel.
This segment is brought to you by Rotomix, manufactured in the USA and designed for feeding performance in the feedlots, beef production, dairy, and cow-calf operations. Hi there and welcome back to DocTalk. Dr. Dan Thompson here with Dr. Susan Nelson, who is an associate clinical professor here in the Veterinary Health Center at Kansas State University. And we're talking about fleas and ticks. We've talked about some of the different diseases that these parasites can transmit to our dogs and cats. Mm-hmm. What are some of the things, let's start out with fleas, what are some of the things that I need to be looking for if I suspect my dog has fleas?
Okay, so things you need to look for if you think your dog has fleas, the obvious is they're itching. There's a lot of dogs who are allergic to the flea bites. And then hair loss, especially hair loss over the rump, so over the backside, over the rump is a very common spot. You might see it down the inside of the legs, backside of the legs. Those are more common ones. Those of you who may have litters of puppies at home, mm-hmm. These guys can get severe anemia. So can adults, but especially these little guys where there's so many fleas on them. You look at their gums and they're just white. They're so anemic, and they can die from a severe flea infestation.
So the allergy to the fleas, mm-hmm. the dermatitis, that's going to result in the hair loss?
Right.
Okay. And redness or
exactly.
Things like that?
Crust, yep.
Okay. And then what about, on ticks, of course, we're going to find the tick on the dog. You got the little ones and then the big gray ones and different things to that nature. But are there other things that we should be looking at as far as clinical signs?
Yeah.
And if I pick a bunch of ticks off my dog?
You may find a little bit of hair loss, but primarily we're probably looking for them, maybe anemia too, but other illnesses that they can get, some of these tick-borne illnesses. Around here in this area in the Midwest, we have ehrlichiosis, which is a type of blood parasite. These guys can run fevers, have lameness, and just in general not feel very good. Lyme disease, which right in this area we don't see as much, but we do see it primarily in dogs east of here. There again, the fever, the shifting leg lameness problems there. And then we do see some Rocky Mountain spotted fever. These guys are really sick, high fevers, not doing well. They get very ill very quickly going on.
So the big thing is if I pull a bunch of ticks off my dog and all of a sudden it's starting to be listless, lame, not acting right, running a fever, it's time to get them in.
Yes, and you should see your veterinarian. The other thing is sometimes there is a tick paralysis that dogs can get. So we may have dogs that just can't get up and walk. It's a progressive paralysis. So getting those ticks off, going to your vet and getting the appropriate treatment.
Sooner
Than later.
Yeah.
It's always better.
Yeah.
Yes.
Yeah. And then what about our cats, the barn cats and different things like that? You know, what are some of the things that I need to be looking for clinically?
Yeah, so for the fleas, there again, the hair loss, the scratching, the redness. The other thing I forgot to mention with dogs and cats, if they eat a flea, they can get infested with tapeworms. So you may actually see, so you may actually see tapeworms. I get a lot of people all grossed out because the cat was on the sofa and got up and there's these little worms crawling around. So, or people see things that look like little pieces of rice or cucumber seeds on the hairs around the hind ends. So they can also get tapeworms from those. So watch out for signs of tapeworms. With the tick-borne diseases, cats, they start running, the couple that we see primarily, they run a really high fever, they might get yellow in the eyes, they are sick cats.
Wow. Well, a lot of things to look for. It's important that we control them.
Yes.
And then when we come back, let's talk about some of the treatments that our veterinarians will most likely prescribe when we do get some of these illnesses, and then we'll come back and wrap up with making sure we know how to prevent it.
That sounds good.
Appreciate you being here.
Howdy.
We appreciate you watching Doc Talk. After the break, more with Dr. Susan Nelson.
This tip brought to you by Baytril 100 Enrofloxacin Injectable, now approved for use in controlling BRD in high-risk cattle. Baytril 100, right the first time, whether it's controlling BRD in high-risk cattle or treating BRD.
Hi there, folks. Today's On the Farm tip, sponsored by Bear Animal Health, centers around the use of antibiotics. And when we use antibiotics, first and foremost, we want to make sure that we follow the label directions and use these antibiotics in an appropriate manner. Secondly, we want to make sure that we're working underneath the direction and supervision of a licensed veterinarian. It's always important to work with your veterinarian to understand the most appropriate times to use antibiotics and how we can use those antibiotics in our farm animals. Lastly, observe our withdrawal times. We want to produce a wholesome, safe food supply, so make sure you follow withdrawals. If you have an opportunity or think that you have a mistake with antibiotics, you can call 1-800-US-FAIRAD, and they will help you calculate a withdrawal. That's your On the Farm tip today from Bear Animal Health, and I'll see you down the road.
Hi, I'm Kevin Ochsner, host of NCBA's Cattleman to Cattleman and Colorado Rancher. Join me each week as the National Cattlemen's Beef Association brings you the latest updates in industry information and market news. Plus, each week we provide important educational information and features on cattlemen from across the country just like you. And we can't forget our favorite cowboy poet, Baxter Black. Join me for NCBA's Cattleman to Cattleman, debuting Tuesday nights at 8:30 Eastern, right here on RFD TV.
Join the team, the Beef Quality Assurance Team. Getting BQA certified shows you're committed to practices that produce the highest quality beef in the world. And by visiting BQA.org, you can take the online certification course at a time that fits your schedule and from the comfort of your home or office. You'll also find lots of helpful tips on improving animal health and animal handling practices. Get certified, BQA certified, because it's about doing the right thing. Visit BQA.org today and become a member of the BQA team.
I'm Dennis Tebow. My wife and I, Kathy, are the owners of Wolf Creek Cattle Company. We have grown to approximately 70 bulls.
I'm Reese Arnold. I'm the livestock manager at Wolf Creek Cattle Company. You know, these are not just like normal cattle. These cattle, they're hauled anywhere from, 8 to 10 hours a day across the United States and asked to perform. The Multi-Man 90 keeps them kind of level. It maintains and balances their system. The stress level is less when everything's right and working right, then they're working right.
Closed caption brought to you by AgriLabs, the perfect pairing of performance and value. Hi there, folks. Welcome back to Doc Talk. Dr. Dan Thompson here with Dr. Susan Nelson, and we're talking about flea and tick control and treatment. And Dr. Nelson is an associate clinical professor here at the Veterinary Health Center. And Dr. Nelson, my dog has fleas.
Yes.
And I bring it in there. I had a person actually bring one to me and set it on my kitchen table when I was in practice and say, what do I do about this? And they're like, let's get it out of the house first. But what are some of the things that we need to do?
Yeah, well, we need to get rid of the fleas. So let's start with on the dog. First of all, you know, especially if your pet's really infested, I would go speak to your veterinarian, because there's a lot of products, most of you know out there, there's shelves. You can just get dizzy by looking at everything that's out there. So finding the appropriate thing for your dog, what works in your area, and if it has any other problems like ticks that you need to address too. There are a lot of good oral preventives that are out there that work really well. Some work for short duration, some work for about 30 days, and then there's a whole bunch of different spot-on applications that are generally every 30 days for our pets. So getting that dog treated, getting it there. Baths don't work so good, and they definitely don't help keep them from getting back on. Some of the over-the-counter medications and the flea collars really don't work that well. There's some newer veterinary flea collars that are different that do work a little better. But my best advice is speak to your vet about what will work the best for your dog.
Okay. Well, we go from the pet to now they're in my house and the environment. And so what are some of the things that you can do to get those fleas out of your house or out of the environment?
Yeah, one of the best things you can do is vacuum, vacuum, vacuum. Better if you have the little beater brush on your vacuum to pick those up. Make sure you either freeze that bag to kill off everything or throw it way out where nothing's going to get to it. Do not put flea powders in your carpet and vacuum those back up. Sometimes those aerosolize up with the vacuum, so it's not good to inhale those.
Oh, the safety part of it.
Yeah, so vacuuming is one of the biggest things. There are sprays. I usually recommend an area spray where you can direct it where you want it versus a fogger, which may just kind of go up and down and not really get under the cushions and things. Hot spots are where your animal lays and spends the majority of their time. Obviously, pets are all over the house, but they usually have special sleeping places.
Right.
That's where the majority of your eggs and some of these other juvenile stages are going to be, and where you need to really focus your attention.
So that's where you'll take that spray and spray that area and then vacuum, vacuum, vacuum.
Yeah, and so the other thing is if you have maybe look outside. Did you have new critters move in under the porch or something like that? That's a reservoir where your pet keeps picking them up and bringing them into the house. So you also have to kind of look outside sometimes also. For real bad infestations, deep steam cleaning the carpet might be indicated too, and possibly even an exterminator for the really bad cases.
Yep. So it's important to note that when you treat your pet, that's part of the equation.
It's part of it.
And then the second half is making sure we get them out of the environment.
Yeah. Yep.
So, prevention, you know, or wait, ticks on the treatment. You know, one of the things is we know we're going to pull those off. Is it okay to just squash them?
No, Dr. Dan, it's not okay to squash them. The reason why is if they are carrying some of these bad things, those can aerosolize, go in the air, and you inhale them, and you can get infected with some of these diseases. So not a good idea. So maybe we should talk about that next time at the next segment and see what we need to do.
Sounds like a winner. You're watching Doc Talk. Dr. Susan Nelson here from Kansas State University. We're sure glad you joined us, and we'll be back after the break.
This segment is brought to you by Lalaman Animal Nutrition, dedicated to the development and production of natural and differential solutions for animal nutrition.
Families working together in a business venture can be a complicated thing. With Ag AM in Kansas, I'm Devin Stewart. An author and family business consultant gave farm and ranch women advice on dealing with family businesses at the 2013 Women Managing the Farm Conference hosted in Manhattan. Jolene Brown says that there is nothing better or worse than farming with genetics.
They have to choose. Do they want to be a family-first business or a business-first family? In a family-first business, we tend to make all of our decisions on tradition and don't rock the boat, and that's how we always do things. But if you really want to count on it for a consistent income, to make sure that you can work well together and even be productive enough to have a business at the end to transition, I want you to honor the family so much that you're going to get the business right.
With Ag AM in Kansas, I'm Devin Stewart.
The Kansas State University College of Veterinary Medicine is a leader in food animal research and education. Our researchers are constantly expanding the knowledge of animal health and food safety. Through the Veterinary Health Center and the Kansas State Veterinary Diagnostic Lab, we provide practical services for animal producers. Home of the Beef Cattle Institute, the college is committed to animal welfare training and research. The Kansas State University College of Veterinary Medicine, knowledge and service for the future of animal production.
Cow-calf, stocker, and feedlot producers know that effective parasite control improves overall herd performance and profitability. Norbrook offers a comprehensive, economical line of pour-on and injectable parasiticides for every livestock operation. Consult with your local animal health supplier to set up a program that protects your investment and brings larger cattle checks this fall. See for yourself why the Noramectin line from Norbrook is the practical choice for your herd. Valley Vet Supply is devoted to providing information and professional quality products at reasonable prices.
Valley Vet Supply.
This segment is brought to you by the Graham School for Cattlemen, with over 100 years of continuous service to the cattle industry. To find out more, visit us online at grahamschool.com.
Hi there, welcome back to Doc Talk. Dr. Dan Thompson and Dr. Susan Nelson here from Kansas State University, and Dr. Nelson is associate clinical professor here in the Veterinary Health Center, and we're talking about flea, ticks, and treatment. And when we left, what is the proper way to remove and dispose of a tick?
Okay, so it's best if you do wear gloves, because if you do have any cracks or anything on your hands and that tick pops, you can also get some of those bacteria and problems in that way through your bloodstream. So then you want to kind of grab closely to that skin and slow and steady. Don't yank, because when you do that, sometimes the head stays buried, it pulls off, it detaches, and then it can still be a problem and cause some infection with them where that is. So slow and steady, put them in jar alcohol to kill them. Don't pop them, don't light a match. Do not put kerosene on your dog or gasoline. Those are all bad things to do to try to remove ticks.
Just manually remove them and then get rid of them.
That is correct.
All right. Well, let's move on and kind of wrap up today by talking about some of the things that you recommend, and we always recommend you work with a local veterinarian.
Mm-hmm.
But what are some of the general preventative things for fleas and ticks? And then let's talk about the differences in dogs and cats.
Yeah. So if you're having both problems, fleas and ticks, most of what you're going to use is probably going to be one of the spot-ons that's available. There are some sprays too, but they're every 30 days. They do a decent job. You still need to check daily for fleas and ticks on your pets and remove those though, because nothing's 100%, especially ticks. Those things are stubborn, they're hard to kill, and it takes several hours to kill those. So still look for manual removal on those. And then if it's just fleas, there's an oral product that works really well for keeping fleas under control for 30 days, very fast onset, kills the fleas very quickly. Or your dog's allergic to fleas, it's a great product. But there's so many good things out there, and there again, work with your veterinarian, see what they think would be best for your dog and what works the best in your area, because sometimes what works in one area may not work in another.
And then just right now, depending on what your climate is, in those moderate climates in the winter, probably just keep them on.
Yes, that is a very good point. Year-round prevention. You're going to avoid those big blooms of fleas and trying to get them under control in your house if you just stick with the monthly prevention.
And that way you're not starting too late. And
a lot of times in the long run, it's better on your budget too.
Sure.
Yes.
Sure. What about cats?
Yeah, so cats, we have a lot of good products out there. Unfortunately, not as many choices as we do for dogs, especially for ticks. We have a lot of flea choices for cats, but for ticks, we're a little bit limited. So best thing for cats, keep them indoors away from the ticks. Otherwise, if you have an indoor-outdoor cat, a barn cat, scour them daily and look for these ticks. And also, one point I would make is do not put dog preventives on cats. Cats are not little dogs, and so some of these products can kill the cats if you put them on.
Well, it's really great information. Treatment, prevention is the key, and work with your local veterinarian. Any closing comments on fleas and ticks?
Well, I would say too that outdoor, we didn't really touch much on that. Keep your lawn mowed down. So try to rake out organic debris. The fleas like it in the shade and where it's cool and where there's a lot of leaves. Ticks like that taller grass. So keep your lawn manicured, keep the debris out, and that'll help keep some of those down outside too.
Thanks so much.
Yep.
Appreciate you being here. We appreciate you watching Doc Talk. Remember, always work with your local veterinarian, and if you want to know more about what Dr. Nelson and I do here at K-State, you can find us on the web at www.vet.ksu.edu. You've been watching Doc Talk. I'm Dr. Dan Thompson here from Kansas State University. We're sure glad you joined us, and I'll see you down the road.
For more information about this program or previous programs, go to DocTalkTV.com. DocTalk was brought to you by Multimin USA, manufacturers of Multimin 90, sure trace mineral supplementation by timed injection.
Mike Davis, owner-operator of the Cooney Ranch, Southeast Oregon. We're running right at 700 head of mother cows. We've been using Multimin for about 5 years now. Here at the Cooney, we're selenium deficient, manganese, copper. I know those are three of the big ones that we are short on. And with the Multimin, I believe that it's helping to up that response. We all do a mineral pack. When we first put it out, they'll eat a lot of it, and as they get it built up in their system, they'll back off of it. The Multimin probably gives them an extra boost to get those other trace minerals going. We give the calves a shot of Multimin at branding, and then the calves will be followed up with another dose of Multimin in the fall when we wean. And then in the spring, before we turn out, we'll give the calves another shot. We give all the cows once a year, we give them a shot of Multimin when we process in the fall. The bulls, we process them in the fall too, and give them a dose of Multimin then. We try and get the bulls in again before we turn them out with the cows, and just give them a dose then, hoping to get a little better preg rate, efficiency out of the bulls. With our replacement heifers, because I'm trying to keep around 100 to 125 replacement heifers, so we'll give them a dose of Multimin before we turn the bulls in with them. Last year we were right at a 98% breed up. It could be a lot due to the Multimin. With Multimin use, everything's been better. The ease of calving, the milk rate, we've been doctoring less and less. Scours, especially, all the cattle are healthier. I feel that Multimin's well worth buying. I believe we're getting what we need back out of it.